Cancer was once considered a rare biological anomaly in India. Today, it presents a widespread and escalating clinical crisis. This chart plots the trajectory of that crisis. We are now crossing the threshold of 10 lakh, or 1 million, new cancer diagnoses every single year, and the projections point strictly upward. A primary driver of this statistical surge is a stark departure from traditional agrarian diets. Multinational fast food chains have integrated themselves into daily consumer habits, bringing with them heavily engineered chemical profiles. To reverse this trend, we have to adopt a dual approach. We must strip exogenous dietary carcinogens out of our routines, and we must learn how to detect the early physiological anomalies of a growing tumor. Oncology specialists are nearly unanimous on the timeline. Catching a localized anomaly before it has the opportunity to metastasize remains the absolute hallmark of a high cure rate. The first clinical warning sign to track is the development of a structural anomaly, most commonly felt as a palpable mass or lump under the skin. It is necessary to distinguish these from standard infectious responses. Swollen lymph nodes reacting to a localized infection are typically painful to the touch. By contrast, a potentially malignant mass presents as painless, indurated or hard, and resistant to being moved between the thumb and fingers. This 3D schematic shows the high-risk regions for these formations: axillary clusters under the armpits, cervical nodes near the neck, and inguinal zones around the groin. In males 20 to 30, monitor the pelvic region for testicular cancer, indicated by an asymmetric, unilateral heaviness. The second warning sign bypasses localized structure entirely. It presents systemically as unexplained cachexia, or rapid, unintentional weight loss. The clinical threshold for concern is highly specific: a reduction of more than 5% of your total body weight within a strict 6-month window, occurring without any deliberate caloric restriction or increase in physical exercise. While rapid weight drop is a frequent symptom of metabolic issues like diabetes or thyroid dysfunction, in a purely oncological context, it heavily correlates with malignancies of the esophagus, pancreas, stomach, and lungs. The third diagnostic marker is the presence of occult or overt hemorrhaging across different physiological systems. Even seemingly mundane bleeding requires context. For example, persistent, unexplained epistaxis, nosebleeds that occur without any physical trauma or irritation, can actually serve as a rare, early peripheral indicator of colon cancer. Moving to other systems, hematuria, or visible blood in the urine, is abnormal outside of menstruation. Similarly, hemoptysis, which is blood in the sputum during a cough, is a well-documented flag for severe respiratory issues like tuberculosis or lung cancer. In the gastrointestinal tract, severe internal hemorrhaging presents distinctly. If a patient experiences emesis, or vomiting, that resembles the color and texture of grounded coffee, it indicates active bleeding in the upper stomach area. This schematic details how bleeding lower down the tract manifests. A hemorrhage in the upper stomach mixes with digested food. As it travels through the intestines, the digestion process turns the blood dark, resulting in melena, stools that appear dark and tarry upon evacuation. Any visible hemorrhage outside of expected physiological cycles signifies a structural breach in the body, making immediate diagnostic imaging critical. The fourth sign shifts back to the respiratory system, presenting as chronic laryngeal irritation. A standard cough clears a temporary congestion, but a persistent, unyielding cough extending past 2 or 3 months, especially when accompanied by sudden vocal hoarseness, strongly suggests a potential mass, such as a thyroid malignancy, pressing against the vocal cords. The fifth sign requires external observation: dermatological mutations. Tracking the formation of a novel mole or sudden morphological shifts in an existing one provides a direct visual indicator of cellular behavior. This clinical matrix visualizes the diagnostic ABCDE framework. A is for asymmetry. B tracks irregular borders. The matrix expands. C is for color changes or darkening. D is for an expanding diameter. And E stands for elevation, checking that a flat mole grows in height. Visual ABCDE tracking allows you to screen for abnormalities at home, But only a professional dermatological biopsy can look at the cellular structure to definitively confirm a malignancy. The sixth and final specific marker is sudden genitourinary and gastrointestinal excretory dysfunction. In the lower urinary tract, symptoms include a sharp increase in frequency without increased hydration, noticeable difficulty initiating the flow of urine, and a persistent dribbling or incomplete voiding. These specific flow restrictions are physical indicators of pressure on the tract, which can point towards severe renal malfunction or localized prostate malignancy. Excretory markers also extend to hepatic function. While dark stools indicate bleeding, stools that present as persistently pale for no dietary reason indicate a failure in the liver's ability to process and excrete bile. Beyond these specific systems, observe your peripheral markers. A localized wound that refuses to heal, a fever extending uninterrupted for months, and chronic body pain that resists standard medication all signal the same underlying issue. When combined, these symptoms paint a picture of a compromised systemic healing response. It is the macro-level evidence that a microscopic cellular takeover is drawing resources away from the body's baseline maintenance. Understanding the symptoms is only half the equation. We have to identify the exogenous biochemical drivers that cause these cellular mutations in the first place. The modern diet delivers a steady stream of known carcinogens. Processed meats like sausages and salami undergo curing and smoking processes that introduce dangerous volatile compounds directly into the digestive tract. The preparation method matters heavily. When carbohydrate-rich foods like potatoes are subjected to heavy frying, they synthesize acrylamide, an organic compound recognized as a probable human carcinogen. Similarly, when meats are overcooked or heavily barbecued, the breakdown of muscle proteins releases polycyclic aromatic hydrocarbons and heterocyclic amines, chemicals shown to alter DNA structure. Liquid intakes carry their own risks. Ethanol and alcohol metabolizes in the liver and breaks down into acetaldehyde, a highly toxic compound that directly damages DNA and prevents the body from repairing the sequence. The etiology isn't solely dietary. Chronic, severe psychological stress, such as the profound loss of a loved one, creates a persistent state of systemic tension, flooding the body with cortisol and chemically compounding existing genetic risks. The modernization of human lifestyle has effectively constructed a continuous, exogenous chemical attack on our cellular integrity. To counter this, Ayurvedic practices rely on highly specific nutritional interventions designed to optimize lipid profiles and defend baseline metabolic health. A primary tool in this protocol is Anvishan A2 cow ghee. Its lipid profile is derived specifically from the milk of robust traditional breeds, primarily the Gir and Halikar cows. The extraction uses the traditional Bilona method. Rather than relying on industrial separation, milk is fermented to curd. The curd is manually churned to isolate the butter, and the butter is heated down to extract the pure golden lipid. This process yields specific clinical benefits. The resulting ghee is exceptionally high in conjugated linoleic acid, or CLA. This specific fatty acid is documented to shrink fat cells, normalize blood pressure, and actively reduce bad cholesterol markers. Because pure lipid profiles do not degrade like water-based foods, sourcing it in traditional 5-liter stainless steel doilies offers an advantage. In fact, ghee aged up to 10 years demonstrates even superior health metrics. The FitTuber community can currently source these Anvishan doilies with a 15% discount. Beyond lipid optimization, broader metabolic interventions are required. Establishing strict circadian meal timings and practicing daily intermittent fasting forces the body to deplete immediate glycogen stores and triggers systemic cellular healing mechanisms. This metabolic discipline pairs with respiratory optimization. Just 15 minutes of daily yogic pranayama actively forces concentrated oxygen into the bloodstream, modifying the internal environment. The potential of these traditional systems is documented in reports of stage 4 oncology reversing through 6-hour daily regimens of Kapalbhati and Anulom-Vilom breathing, observations that point toward the body's capacity for intensive metabolic and respiratory recovery.